everyone. I'm excited about bringing on my next guest because I really want to hear about this. My next guest is Dr. Ryan Krch. He's the owner and Chief Medical Officer of Krch Aesthetic Med. So welcome to the show. I want you to tell everybody a little bit about yourself and what we're going to talk about today. Listen up, everyone.
Hey, Carol, it's great to be here.
Put right up on that mic for me.
I'm Dr. Ryan Krch. I've been doing aesthetic medicine for about 20 years now, with a very strong emphasis on hair. That's kind of like our biggest thing.
Right.
Is restoration of hair. Yeah.
So today that's what we're going to talk about, folks, is restoration of hair, and a lot of people can use this. Now, I want to ask you why hair is so important in our culture.
You know, it's basically it's a sign of youth. It's a sign of health. We look at it that way. Hair in itself, it frames the face. It frames the eyes, the eyebrows, and lashes. We do not only scalp hair, the hair on the top of the head, but we replace eyebrows and beards.
Stop looking at me.
Everything.
Okay, go ahead.
Yeah.
Well, you know, it is important, and it's the crown of yourself. You know, when you go out, that's your crowning. I guess a crown is what I could call it, right? Now, the difference with Krch Aesthetic Medicine, what's your approach compared to other people?
Yeah, there's an axiom in medicine that if you listen to your patient, they'll lead you to the cure, and I think that's probably our strongest thing. There's no one way to approach hair for every individual, and so we spend a lot of time to find out what their goals are, if they're reasonable goals, if we can really hit those goals. And then find an approach where we're not only preserving the native hair, the hair that's on the top of the head is your native hair. So we're implanting in around that. If that native hair starts to go away after we've done the hair implants, it's kind of moving backwards. So you gotta have, and this is what I think is lacking with a lot of companies out there, clinics that are doing procedural medicine, is they're not addressing the native hair and making sure that that's staying there. So there's approaches with PRP, with supplements, with prescriptions to hold on to that native hair as well as give you that new hair.
Where else but on Networking Arizona would you hear what native hair is? You know, I mean, really, honestly, I never knew, and I think I got a lot of native hair. Okay.
You do.
I do.
Great.
I do. Thank you. But it's important that people want to get this in. You know, we're talking about hair transplant, right?
Right.
Now, you're located in Central Phoenix at 12th Street and Missouri, and you do free consultations.
That's right.
And right now, what we're going to do is we want everyone to know that if it's you or someone that you know, and you know, women sometimes are the catalyst of things, you know, and you're sitting there with your significant other, you know, kind of hit him at the elbow and say, you know, something, we need to take care. He's giving 15% off if you tell him that you heard it on Networking Arizona. And the phone number that you want out is what? What do you want out there?
It's 480-493-5833.
So let me repeat that for you, 480-493-5833. You can check it out on his website. It's Krch. Now let me spell that for you, krchmed.com. Tell them that you heard on a Networking Arizona, you're going to get 15% off. Okay, so you sort of talked that there's challenges when it comes to hair loss, right? You have your own story?
Yeah, I do. About 2 years ago, I was diagnosed with cancer, went through some pretty tough chemotherapy.
Sorry.
Things are going great now. We're a year past the immunotherapy and negative PET scans all the way, and got back out on my bike this morning.
Oh, good for
cycled,
you.
on
See,
Sunday.
doctors get sick too.
Yeah, rode some 16 miles and feel great. So yeah, we're glad to have that in the review mirror. But during that, went through some pretty tough chemo and took out all my hair.
Wow.
I'd had a transplant. I was a little bit thin in the forward scalp, so I had a transplant done with my crew back in 2019. But the cancer was 2023, and yeah, the chemo took it out, and I think I could always relate to my patients because I had my own hair challenges. But now, you know, having lost all my hair, eyebrows, lashes, top of the scalp, everything, it was really quite a change. I saw how much it changed my appearance, and I think most of the people coming to us at some point relate how it's affected their confidence.
Sure,
and their
absolutely.
ability to engage in things and stuff. And I suddenly understood that, I think, better than ever. So, more than just having had the procedure done, I know what it's like to look like that.
Right,
So,
to feel that.
yeah.
And when it comes to your appearance, I know it's not because you're that's so important to you. It doesn't have to be. It is something that makes us feel better every
does,
day.
yeah.
And having hair is probably number one. I would say hair and teeth, somewhere
Yep.
along there,
Yeah.
right? And when it doesn't matter, when it's happening to you, that doesn't matter what it is, as long as you feel good, that's the main thing. And when
Right.
now we have so much, and hair transplants have come a long way.
They really have. It's no longer these plugs and this very uniform, kind of unnatural look. We have a fantastic team of neografters, the hair transplant, and these are the people that go around to the doctor's offices and train them on how to use these devices and stuff.
Wow.
So it's a very advanced, very knowledgeable team.
You talked a little bit about PRP in hair restoration. What is it?
Yeah, that PRP is platelet-rich plasma. And so what we do is we draw the blood from the individual. The platelets in the blood are stem cells, and I came at stem cells because I used to inject them into knees to grow cartilage and things like that. But it turns out, of course, that almost any place we put that, it'll have a benefit. So if we put it into the scalp, in many situations we can grow hair. That's a little more successful with females than it is males. But what we see is that it does grow some hair for most people. We also use it as an adjunct therapy when we're doing the hair transplant, because we know it reduces the recovery time. It also increases the viability ratio. The industry standard for hair transplant is about 85% of the hair that we put in is going to thrive. So if we do 1,000 grafts, 850 are going to thrive. You're paying.
That's not bad.
You're paying for the grafts that we put in, not the ones that thrive and survive. So when we do the PRP as an adjunct to the therapy, we're seeing rates of about 90–95% in some situations. So
That's not bad. And I think this is something for people to really think about. When you hear it, you think, oh, that sounds so strange. A couple of different things. Number one, who's a good candidate?
Definitely, this is an aesthetic procedure. It's an elective procedure. So we want individuals that are generally very healthy to do that. It is a bit of more of a challenge when the patient is very young and it's aggressive hair loss. It's going to be probably a lifetime of effort to hold on to that hair. It just depends on the individual genetics.
Right.
So we do get those patients, but we also get the patients who are older. The hair loss is probably stable now. It's either receded or thinned, and those are the individuals that are probably going to do the best. But we work with a full spectrum.
Both men and women.
Yes.
Right?
Yeah.
And so you do free consultations. He's located right here in Central Phoenix at 12th and Missouri. The phone number is 480-493-5833. He's offering 15% off if you tell him that you heard it on Networking Arizona. It's Krch, Krch, med.com. I'm going to try and get to all of it, Doc. I really am. Okay.
I wrote a lot of questions.
Yeah, really. I do want to ask you more than anything right now. Does it hurt?
That is the thing that we really are careful about. It's ironic in that the thing that causes the most discomfort is the placing of the anesthesia to make it comfortable. So to make that more comfortable, we actually do a little bit of twilight anesthesia. So same thing you get at the dentist's office to make you, put you in the kind of that happy place.
It's worth it.
Yeah, it is. It really is. And we encourage
Definitely.
everybody to do it. So.
Yeah, let's say someone has already had a transplant. Can they get another one if they wanted to?
Yeah, in some situations when you're getting more than like 3,000 grafts, we'd rather do that in kind of phased approach.
What's the recovery like?
It's really about 2 weeks of not heavily restricted activity, but just, you can do light activity. You got to keep the head above the heart when you're sleeping for the first week. The care is really easy. We do this procedure typically on a Saturday. By Monday, many people go to work.
You got to check him out on the website. It's Krch, Krch med.com, or call him at 480-493-5833.